Now here's your host, Billy Schweim.
All right, we're back broadcasting live from the Toms River Auto Group studio right here in Northfield. It's the locker room. Billy Schweim and intern Andrew Leeds. And my new producer, Danny Ryan. It's the youth movement in here in the locker room. And, guys, we're one day closer to the beginning of baseball, opening day. Yep. Albeit on the road in Arlington, Texas against the Rangers. But we'll be starting this season without RHys Hoskins, who tore his ACL. And, I've had my ACL repaired, reconstructed. My brother had both of his knees done. But technology has got a lot better and improved medicine. So I talked to the guy that I trust the most. He's the chief of sports medicine at Virtua, Orthopedic Surgeon Dr. Sean McMillan. Let's go to the Maserati, the Mainline Sports Hotline, and welcome him in. Good morning, Doc.
Guys, how we doing this morning?
Well, I'll tell you what, Dr. McMillan, we're concerned because you're cruising along, everything seems to be going well, and then the ugly injury bug steps up and bites us in the rear. In this time, it's RHys Hoskins goes down to a left knee ACL. So my question to you is, what's the fastest you've ever seen somebody recover from an ACL?
Yeah, so, a guy like that, professional baseball, you're talking 6 months on the early side, Billy. Just to be very honest, I think Schwarber did it in like 204 days a couple years ago for the Cubs.
Yes.
But, you're looking at about 6 months there before him getting back out there and probably just DHing and, lending a power bat for the playoff run.
Now, Dr. McMillan, you've that's what you do. You're orthopedic surgeon. When you get in there, obviously the MRI shows you there's a tear. But when you actually open the knee up, do you see? Then you get a real idea of what's going on.
Yeah, absolutely. We can evaluate the other structures in the knee, like the meniscus and the cartilage, and look, each one of those, are something that could be at risk for RHys. But at the end of the day, the ACL will be the thing that takes the longest for him to get back from. Now,
did you see the injury itself, Doctor? Did you see him actually hurt it on the field?
I did, yeah. I saw the highlights of it, yeah.
What did it Did it look like? I mean, it didn't look like anything terribly went wrong. Like, didn't see sometimes you see a knee blowout, it's pretty gruesome, but it didn't look like he did much.
Yeah, and I'll be honest, Billy, that's how the majority of ACL injuries tend to happen. Non-contact, rather innocuous injuries. He was just going for a ball and sort of took a step and his whole knee just buckled. And the second he went down, I mean, someone told me about it. I looked at the highlight quickly, and you just kind of knew it was going to be an ACL, and I think there was little doubt in everyone's mind. You see a guy like that who's in the prime of his life, 30 years old, have to get sort of taken care of by the EMTs. It's upsetting. It's sad, but it's something that we all know he can come back from with the way we do technology now.
Now, speak of modern technology, I said this in the beginning of my show. When my brother Bobby first tore his knee up in 1979, Doc, when he came out of surgery, he had a full-length cast. You guys don't do that anymore, right? You got like a hinge, and when you come out of surgery, you have that knee moving right away.
Yeah, I mean, it's crazy how far it's come. We went from being terrified to move the knee because we were afraid it was going to fail to trying to get you moving as quick as we can and get the muscle firing again. And that's part of the reason why we can have guys come back so quick and so healthy. We're
talking with Dr. Sean McMillan. He's the chief of sports medicine for Virtua, orthopedic surgeon. Doc, when you tear, give me the degrees of tear. How do you define the tear? Is it completely torn through, or is it ripped like a little bit? How do you diagnose that?
Yeah, it's a great question, Billy. So in this case, he has a full tear, and the ACL, one of those structures that at this point when you get to be a professional athlete, it's either torn all the way or it's not. Partial tears are sort of the worst limbo to be in. But in this case, he's fully torn, needs to have it reconstructed, which means we actually remove the native ACL or the ACL he was born with, and we take a piece of tendon from another part of his body, usually his kneecap tendon, and make a brand new ACL for him.
And is that when you say you take another piece of a tendon, where do you get that from? Like what part of the body?
Yes. So we actually take a portion of the patella tendon, which is the kneecap tendon, right in the front of the knee. The way we're made, it's usually about 2 or 3 times the size of what we actually need. So we're able to take a small sliver of it, and then we're able to put that where the ACL belongs, and the body turns that into a ligament.
Dr. McMillan, is it like so when a pitcher gets Tommy John surgery like on the elbow, they say it's like stronger than it was before? Is it the same with the knee?
It's a little bit different, Billy. Obviously, we say it's stronger than what it was before in the sense that we rehab the heck out of it. So you're spending 6 to 9 months just really blasting a part of your body that you work on normally, but you don't spend every day working on. So from that standpoint, he's going to come back a much stronger individual for his lower body. But that ligament, the one God gave us is probably the strongest one we're going to get. But this one does pretty darn well.
Hi, doctor. This is Andrew Leeds. I just had a quick question about the mental side of dealing with, coming off of an ACL injury, because obviously that weighs a huge part in a player's ability to be able to come back. I mean, you see how Carson Wentz, he never was quite fully the same after that ACL injury, and a lot of that seems to come from.
And by the way, I can speak intelligently about this because I've had full knee reconstruction, and you're right. That's a great question, Andrew, and Doc, you can explain this, but putting your foot down, like after you rip it, like I felt like, if I could describe it, it felt like if you could grab a phone book, and remember the old thick phone books? If you could grab a phone book and like rip it, that's what mine felt like, right? So from that point of view, Doc, every time I went after I was rehabilitating to put my right knee down to make a plant was like I couldn't get over that mentally.
Yes, it's a great question, Andrew, and I'll be honest with you. The healing side, I mean, the graft that we put into the knee, healing into the bone. I mean, that happens, around 6 months. Even sooner. But there's a lot of other things that go into that. And the mental aspect is one of them. And it can take sometimes a year to sort of 18 months to trust the knee again. Yeah. So you have a lot of guys come back that first year and say, I'm playing, I feel good, and you say all the right things. But then you catch them a year or two down the road, and they'll tell you, in their heart of hearts, they knew they just didn't trust it. They were still fearful of, maybe it re-rupturing. So it takes, probably a season or so to actually get back to where you're not thinking about things. Obviously, baseball is a bit different than football, where guys are taking your knees out all the time. But certainly, it's something that's going to take a little bit of time for them to get used to again.
Hey, Dr. McMillan, Danny Ryan here. Now, I wanted to pivot a little bit away from the recent news with the Philadelphia Phillies and their injuries to news that broke 2 weeks ago. Phillies top prospect Andrew Painter had a right proximal ulnar collateral ligament sprain, which is, correct me if I'm wrong, a slight tear in that area of the arm. And I wanted to get your opinion on it. I mean, you are an orthopedic surgeon. If you're the Philadelphia Phillies, 2 weeks ago they said they were going to shut him down for 4 weeks and then do a light throwing progression process. How do you think they should treat this injury? Do you think they should, if he's not improved after the 4 weeks, just go with the surgery immediately or try and rehabilitate him naturally?
Yeah, so again, this is a question that comes up a lot because we see a lot of young pitchers as well. Again, trusting what's read, and I haven't examined him, I haven't seen his images. When you have a sprain of the ligament, a sprain means that you have a partial tear usually, right? And we grade these from, mild, moderate, and severe. By and large, everything I've read sounds like it's just, a mild injury. So the first thing is what they're doing, which is you shut them down for 4 to 6 weeks. Let the ligament heal, let the swelling go away, and then you start to sort of test it a little bit, on exam and also with a light throwing program to see is there pain or not. If he's pain-free, you can begin to progress him, and they'll take that pretty darn slow. If it doesn't, you have options before surgery. They can choose to inject it with some of his own blood called PRP or stem cells. They could choose to do an intermediate surgery if they feel as though that's required, meaning if the elbow's unstable, but some of the ligament is still intact, they can put a very strong piece of suture over top of the native ligament, and that can sometimes reinforce it. That gets you back a little bit quicker. Think about Mike Trout when he had that quote-unquote internal brace procedure done on his thumb a couple years ago. Very similar. And then if all else fails, then you reconstruct it. Sounds as though he's a long way from that part where you're looking at the 18-month recovery from the reconstruction. But they're going to be really, really cautious with him because they don't want to push him down that road.
We're talking with Dr. Sean McMillan. He's the chief of sports medicine with Virtua, orthopedic surgeon. Doc, when you just tear your ligament, what is that when it heals? Is it looser, more loose than it was before? Or does it heal like better than gets back to new?
Bill, you're talking about the ligament in the knee or the elbow?
The elbow.
Yeah, so when you tear that ligament, it'll scar right back down to where it is. So when you think about these partial tears or these sprains that are sort of micro tears, you still have good integrity of the majority of the ligaments. So if it was, say, 100 strands of rope that were put together, maybe you got 10 or 15 of them that are frayed, but by and large, your structure's there and it heals over and you're fine. It's when you start to lose, too many of those ropes and, you're more than 50% gone. That's when you get concerned. And obviously, their MRI was performed, and they feel comfortable with the course of action that they're going with right now.
Hey, Doc, Danny Ryan again. I appreciate your insight on Painter's injury and really how the Phillies could treat this process. But the reason I asked, large in part due to, was Stranthony Dominguez. In 2019, his season was ended early due to the same injury. It was a more damaged ulnar collateral ligament, but he didn't pitch again for the Philadelphia Phillies until 2022. So that's why I kind of ask, they shouldn't really, mess around with this, right? I mean, they should, if it's not healing, if it hasn't progressed after the 4-week shutdown, probably get the surgery ASAP, right?
Yeah, and again, listen, I'm not going to dispute what you're saying. It really, truly depends on what that ligament looks like.
Mm-hmm.
You know what I mean? Because, listen, once you undergo surgery, as good as we think we are, there's no guarantees. The return rate is somewhere in the 80% right now. So while that's great, it's not 100%. So I think they're going to shut him down. If he's still having symptoms, they'll probably try one or two other things non-surgically to see if they can get him to heal. Think about Tanaka. Tanaka had a similar injury, was treated with conservative care, blood injections, time, and ended up having a really good career even after that. Ohanti, again, tried that, ultimately failed. Again, a little bit different. So I think they're going to weigh all their options. And listen, there's going to be agents involved, and second opinion doctors involved. So ultimately, the player's going to have 4 or 5 good opinions before they decide to shut it down or try a different course of action.
Well, Dr. McMillan, you took care of my knee. I'm going to have to come back and see you again because that's starting to wear off. But I'm feeling pretty good, and I'll definitely be in your office soon, though.
It sounds great, Bill. Listen, be safe, and I'm happy to take care of you.
All right, thank you so much for giving us your insight and expertise on the sports medicine questions that we had for you today. Thank you, Doctor.
You got it, guys. Bye-bye. There
he is, Dr. Sean McMillan, the Chief of Sports Medicine, Orthopedic Surgeon at Virtua on the Maserati, the Mainline Sports Hotline.